So in order to look after my own well-being in these situations, I guess there's a number of different things that I might do. The first is quite a bureaucratic procedure of making sure that if I got hit by a bus on the way home that evening, there would be a record of what I talked about with this student, so that student wouldn't have to go through it with somebody else. So I make a lot of notes, I kind of make sure that key people are informed, and that helps offload some of it, kind of putting it into bare factual terms, helps shift some of the responsibility. In preparing for this interview, one of the things that I realise that I do is I forget. And if you're handling and working with the number of personal tutees that I've been working with over the last few years, you kind of need to forget that there are some cases or some names that I hadn't really thought about for the last 3 or 4 years until prompted to think about them just now. Because you can't carry that amount with you, and I think that's probably true if you've got 10 tutees every year. It's just too much for any individual to carry. You do what you can with the people that you can support, and you accept that there are always going to be people that you can't help, that it isn't the right time to help them, you're not the right person to help them, whatever it might be. So to recognise your limitations in that way and accept that you can still do good for some people.
So initially, when I started supporting students through these difficult conversations and the issues that they were experiencing, I didn't really know what I could do for myself. And I think it's over time I've learned that it's really important to have that self-care element. And what I tend to do is I discuss some of the conversations and issues with other relevant colleagues that are working with that student. And I do this with the consent of the student. So it means that I'm not carrying all that information, just me, and I'm not solely responsible. So that's really helpful, and actually other people can then give you advice on how to manage the situation as well. In terms of other kind of care, I think it's important to realise there's only so much you can do. And I think sometimes you might be in a position where you think you want to fix the problems, but we have to realise that we're in a personal tutor role. We're not there to fix someone's problems, we're there to support them and guide them. And it's realising that that's really, really key to your own self-care, not just a student.
I think it's important to have discussions with colleagues about the experiences you have as a personal tutor, obviously without mentioning any details of the student's personal circumstances, but there are supportive colleagues in every department. So there are people with roles that can help you, sort of senior tutor roles, things like that, who you can discuss things with. But I've found that colleagues generally are all experiencing similar things, and it does help to chat and to try and share the burden in some way, even if you can't share any details.
It's this tandem balance really which is difficult. You've got to be open and accessible, but you also have to know when to draw the lines and push them away. And it's this conflict, sort of this push and pull between giving that trust, trusting students to do what is best for them as well. And if they can go away with the self-esteem boost of knowing that you have given them appropriate guidance and that you have faith that they can take it to the right support services or manage things themselves, that can help. I think follow-up and communication are the other big issues for self-care as well. If you know you're going to be following up with a student in 2 weeks' time about a very specific issue, it's not going to be at the back of your mind as something to worry about. Is this person okay on an individual level? You're treating it professionally, you're doing your job, and those boundaries are in place.